Okay, to start off with, the topic for the day is revolutionizing healthcare through XR technology, tracing the path breakthroughs of XR in the medical field. I am very excited to have three of the esteemed people from the industry joining us for the session. I would like to introduce each one of them one after the other. First all, we have Dr. Rajiv Ranjan. He is the CEO of Zagnosis Labs. Completing his MBBS from Government TDMC Kerala, he started his journey from a rural place in South India. He has worked in Department of Neurosurgery at AIMS New Delhi and then at Department of Critical Care at Medanta, the Medicity. Currently serving as the Chief Executive Officer, he is a man with the great vision of working towards betterment of society. His keen interests are in teaching, research, clinical practice, social work, and also in entrepreneurship. Welcome, sir. We are very happy to have you on board today.
Thank you very much. Thank you very much.
Next up, we have Mr. Sujit Kadyar. He is working as the director at Surisolis Venture Private Limited. He is also an entrepreneur and healthcare technology professional with expertise in digital healthcare. Besides, he is the regional director at Chamber of Commerce and Industry of India and also a business advisor at Next Consultant Advisor. He has a deep understanding of Indian healthcare system and Indian system of medicine. Worked with a number of hospitals and healthcare establishments overseas, like US based chain of clinics, India based well known homeopathy chain clinic, and also others. We are very honored to have you, sir, and we expect to have a great session today with you on board.
Thank you. Thank you for having me. Yeah. Namaskaram. Looking forward to it.
Thank you, sir. And lastly, we have Mr. Pankaj Raut. Driven by the vision to create grassroots level impact, Pankaj Raut is currently the co founder and CEO of Ajna Lens. He has worked as an hardware architect at imcar.vc and designed and developed one of the most advanced 3D scanning system in Europe and Asia. He has also worked as a CEO at Dream Machine. However, the urge to do something bigger and better for the society paved the way to co-found Ajna Lens and drive the mission of making India a leader in XR technology. Thank you, Pankaji, for agreeing to join this session, and we look forward to having a great discussion today.
Namaskaram everyone. Pleasure being here.
We have already introduced everyone, and now we'll start with Mr. Rajiv ji. So, first all, we'll have a discussion of the background of each of our panelists. So, Rajiv ji, your journey from a rural hospital to working at top hospitals like AIMS and Medanta, and finally as the CEO of Diagnosis. We would love to know more about your journey, your learnings, and even the reason why you have shifted towards different areas and why today at Diagnosis.
Yeah, thank you very much. So the journey is very mixed reviews for myself and for everyone in the medical field. It takes around 15 to 20 years to settle and to uh, fulfill your vision towards your pathway towards your vision. So like I belong to the land of Bihar and Patna. My birthplace is Patna, and I got a chance to all India to go and do my MBBS in Kerala. So Kerala, as we all know, Kerala is known as has the ultimate healthcare infrastructure in when considering all the different states of India. So I was really blessed that I got an opportunity to do my MBBS from Government Medical College, TDMC, from Alapura. It is in Alapi. It's a very beautiful place. So I am a 2003 batch grad. I entered into MBBS in 2003 and passed out in 2009. So when I was doing my MBBS, Kerala, though it has a very well established healthcare system, but during those time, I mean in 2003, back around 20, I have completed almost 20 years when I entered my MBBS. So back in those days, the technology was not as swift and as robust as we are having today. So we had to focus on the contemporary learnings and the old style of medicine practice and all. And during my period only, we witnessed one of the most tragic situation, natural calamities, that was tsunami. So tsunami just happened in 2004 December, and I was one of them who witnessed it very closely. So all these things, these natural calamities, this pain and all, made me more braver, and made me give me an impactful thing to decide more for my future things, how it will I will go in my this healthcare profession. So starting with that, the journey from I worked in lot of rural hospitals. After completing, even after completing my MBBS, I stayed back in Kerala for a couple of years, because uh, being apart, it's so beautiful. It's known as God's own states and all own country, but in the rural areas there was a lot of means differences in the healthcare practices. So I stayed back. I learned different aspects of medicine practice and all. So inculcating from that place, I moved back to Delhi. And after coming to Delhi, I got an opportunity to join AIMS. Initially, I joined as a neurosurgeon, but I was not enjoying the department. So after a brief instinct with the neurosurgery department, I left the department and moved back to Medanta, because I was initially interested in cardiac surgery. So there I got an opportunity to work with world's renowned cardiac surgeon, Dr. Trehan. So I worked with him for almost 2 years, but still my zeal for learning and my zeal for how to make a difference in the healthcare was not satisfied. So finally, I joined again AIMS with the Department of Laboratory Medicine, now as a MD student. And the reason behind choosing this department was a very critical analysis on which my future foundation of my career and my everything was dependent. So though this department is not very familiar across the world, and especially in India, because if you'll ask any of these people, even in medical fraternity also, they will go blah blah like what is this department, because this department is being started around 25-30 years back in AIMS. And everywhere where you go to corporate hospitals or outside India, Sujit sir must be very much familiar with it, because I keep following him, and he is one of most vocal person I have ever seen, who is vocalizing for the upfront technology in healthcare. So Department of Laboratory Medicine is one of the most critical department in the healthcare, because uh, diagnostics is something from where the journey of a patient starts. So you go to a patient, you go to a doctor, and the doctor prescribes your medicine or any test, or even he decides for a surgery only when he's satisfied with the diagnostics, your body's test results, different parameters, different test results. So it has got a very significant role in a patient's journey to his healthcare. So I choose this department, and along with my seniors, my professors, we started working on it, how to improve the diagnostics across India and in different sectors of the society, because diagnostics has seen a lot of challenges. Because uh, I'll give you a small example that uh, lot of quackeries are going on in diagnostics. And with the advent of this covid after this covid came, and a new section of ghost healthcare people have emerged in this sector, and they are playing diagnostics like anything. They are playing diagnostic like grocery. You go to people and they will say that I'll get it done, your CBC or LFT parameters in 100 rupees, then they will bargain for 50 rupees or something like that. This is really very alarming what we are going through right now. So cutting short all those things, so I started my medical career in rural hospital, then coming to AIMS, then doing my MD medicine, MD laboratory medicine at AIMS. I'm running a international, very successful NGO by the name of Aid for Mankind, where we are dealing only healthcare parameters. And I'm really proud to say that we are the only NGO in India who had an MOU with the government of India, Ministry of Environment, Forest and Climate Change, where we are giving our services to all the 53 tiger reserves in India, where we are looking and giving care to all the almost 25 to 30,000 forest workers, including the IFS officers. And now this one of the most closest thing happened to me is diagnosis. So I founded this last year, diagnosis, and right now I am the CEO of diagnosis. So it's all a mixed thing for me.
That was quite a great journey, I would say. But then, as you have stepped onto the entrepreneur journey, it's like starting of the second phase, and there's more to come. And we definitely wish you good luck. And we know that when you have done so much, and when someone has felt all the problems, all the root causes himself, then implementing it and bringing about a change is actually not very hard, because we know where the pain points are, and we know how important or crucial it is to rectify those things. So that was quite an awesome journey.
Thank you.
Moving on, I would ask Sujit ji, driving down the memory lane and revisiting the time from when you graduated as an engineer and now working in multiple in the digi health industry. So, like you have worked with multiple organizations and entity on a everyday basis, I suppose. So, what has been your journey like, and what motivated you to enter into this segment from a time when digital health was very new and very nascent, I suppose. So, we would love to know your story.
Sure. First of all, knowing more about Dr. Rajiv, that was a good thing. Though we are connected, we have exchanged messages quite a few times, and we have, I think, spoken once or so. So it's really great. Okay. So coming to my side, I'm a tech person. Okay. Graduated in 1996, and then 99 something more, some PG thing, and I believe in like constant knowledge update. Okay, so during this discussion I'll tell more things. Okay, currently I'm pursuing LLB. Okay, so that's completely different thing. So now it's combination of tech, healthcare, and regulation, three things. And LLB just because of regulation thing, because I was hoping many things in India to take place, and I'm lucky to see it quite early. Okay, I was hoping like after let's say 2025 this will happen, and 28, 30. I think quite a few things happen, and quite a few things are in process. Okay, so it's been around I think since I graduated 27 years, and so from technology point of view, it's been really long, and not the duration point of view, the way things have changed, that's really like earlier you used to like in 50 years, in 100 years this much happened. Okay, here like every decade or so, it's a completely different thing from tech point of view, and same goes with the healthcare, digital healthcare or healthcare technology or whatever. So initially, when I started, it was like a desktop thing. You used to have some CD drive to install the software. So challenges were different those time. The memory challenge was there. Okay, while coding, initially I was a software coder developer. So you need to take care of the memory also. Okay, and whether it's RAM or it's a hard drive, the ROM, everything was like very much optimized. Yeah, that time we used to have even less than whatever we are having on mobile. Okay, right now. Okay, so from that point of view, so that was a different thing. But at the same time, there were no expectation. At least in healthcare, I have been in healthcare throughout from start. So there were not too many expectations from healthcare. It was just to store the data, retrieve the data. Okay, so certain new patient, and then you save the data, certain diagnosis, certain very less things. Okay, and then usual kind of report. Okay, so some report on this month, and mainly was related either with the financial thing, mainly with the administration and management. Okay, nothing was related with the clinical or something which can help in further planning or something. Slowly, gradually, expectation from reports was like more. We need these kind of reports also. We need some graphical presentation, because that's what many management people they have seen in other this thing. And slowly, gradually, then data analytics. Okay, so then when you need more things to be presented, then you need to have more data to feed there. Okay, so that's how software, which were earlier very you can say very simple, became complicated. Okay, because when you need many reports, many things out of data, so then you have to feed the system, and then data analytics, and then artificial intelligence and whatnot. So I'm lucky enough to see. I started like in academically. I started with Fortran 77, which I doubt many people would have will be having any idea about that. Okay, so in academics, it was Fortran 77, then C++, and then ASP, .NET, and whatnot. Okay, so this the entire journey when you sit. Okay, so that I have gone through because of your question. So from where to where the technology has reached. So now today expectations are such at such a high level that people are like talking about this technology might replace at least certain jobs uh, everywhere, including healthcare. Okay, so that's a separate thing to discuss. But technology has reached to a level where you can talk about these things. Okay, so this has been a long journey, and of course here in India or globally, things have changed quite a bit in last decade or two, but more is there. Okay, because when you say like from 2001 to it was like retail, fintech, then e-commerce, and then so many things. But this decade is going to be next 5 years will be of healthcare, that I am pretty sure. Okay, there is need. Okay, technology is ready to provide. As far as India is concerned, India is ready to take. Okay, because I have been working with the rural also, so many times people ask like what kind of adoption and what this thing. Adoption is there. They have adopted. Okay, if you go by number 70 crores, this device says 130 crores, and this data, and everybody is aware of those things. So data is there, data speed is there, devices are there, they are using the technology, they are using WhatsApp, social media, everything they are using. So then why not they can use digital health, why not they can use health related apps. So now it's a challenge to the tech industry, uh, that they should make it simple. Okay, don't give something very complicated to them. Okay, don't try to copy. You get inspired from the apps from overseas, but don't create copy, because here the literacy level are, and the other things, those are completely different. Those are not the similar kind of thing which are there in overseas. So that's how here and there changes. Government side, okay, during this thing, maybe I'll if given a chance, I'll discuss what government has been doing from the interoperability point of view, from the data privacy security point of view, what already they have done, what they are planning. Okay, so that's from my side.
That was great. Like we have a lot to learn from you, and we hope that throughout the session we'll get some great insights from your end. Thank you, sir. Next up, like to ask Pankaji. So you also have been a store person who has hailed from rural areas, from a small town called Sangli, and then you went abroad for your studies, and then you came back to India to pursue your dream of solving problems at the grassroots level. So we'd love to share your story and what has been the journey, and why did you come back to India even after having a great job there.
Thank you, Krishna, and it's so amazing to hear Rajivji and Sujitji's journey. I think it's inspiring, very inspiring, and we need more and more stories like this discussed more often, so more and more people are inspired. As you said, my journey, yes, it started from Sangli. I was the curious kind since young early childhood. So I was very fascinated by all this technology movies. I used to watch Bond movies and try to make technology at home. So I used to get these toys. I used to try to open them. I was more excited to break open a toy than play with it. I was more excited to open, try it, fit it, see how the motor works, see how the cells work. So since early childhood, I was very fascinated by technology, and I knew that anything I do in the future, I would want to probably do within the technology space. So I was one of those guys who actually wanted to do engineering. It was not like my parents forced me. I was like, I want to do engineering. They were very clear. My parents are into business, so they felt that okay, ye bada okay, come and sit on the gaddi. That was the expectations of the family. But I felt, nee, I'll go into technology. But the challenge there was I wanted to study everything. I don't wanted to study mechanical, computers, or telecommunication or everything separately. I wanted to study everything. That was something I was very passionate about. I always felt that you can't really just learn one thing. I wanted to learn robotics. I wanted to learn computers. I wanted to learn everything combined. So back then in 2008, 2010, there were not many colleges in India. They were doing something like this. But I had access to an internet cafe back then. So I went to an internet cafe. I just looked up on some search engine, mechanical plus electronics plus robotics all combined. And I saw a very interesting word called mechatronics engineering. I felt, wow, that's amazing. The word itself was so fascinating. I just wrote it down on my hand, mechatronics engineering. I showed to my mother, Mom, I want to do this. I want to do mechatronics engineering. Fortunately, I found that some universities internationally were doing mechatronics engineering. But coming from Sangli, coming from okay to do family, going outside India was not something you discuss about or talk about as well. Uh, so we were thinking, what should I do? So what I did is I just took photos of everything that I had done in my broken English, started writing letters, and I started randomly sending it to all the education institutes across UK who were doing mechatronics engineering. Fortunately, I got a partial scholarship, which was very exciting. So because of the scholarship, I went to UK. I studied mechatronics engineering there. I was the youngest in the class. Although my school college fees were partially taken care of by them, my father took the remaining loan. To support myself in terms of rent, food, and everything, I started working part time. That is wherein I started working as a barista, waiter, everything. That gave me interest into other thing, which is human psychology. Because in London, you have people coming from multiple backgrounds, multiple thought process, multiple perceptions coming together and having different perspectives on the same thing as well, which I felt was very interesting. So technology and human consciousness were something which were very interesting as I studied that. But after my graduation, I started working for a company. While I was working there, they wanted to create a revenue source. I did propose them an idea of setting up a 3D scanning system. The system did really well. It made quite a lot of money for the company. The company grew drastically as well, and that's when there was like a big hit that came to me, that more and more people like me are going outside and doing a lot of value addition there, wherein there are a lot of grassroots challenges here within the nation itself. And if more and more of us are going there, like if you look at all of these big organizations, either they are leadership positions or even entry level engineers, are people who have a strong intellect are but going outside and doing a lot more value addition. So I decided to come back and do something for the nation at the grassroots level. That is when I met the other two co-founders and decided, okay, we have to do something for the nation, for the people, and we wanted to create the next generation of technologies for people to have a positive impact. And that's when we decided, okay, we'll create the next holographic computers or the next spatial computers, which we now know as AR or VR or mixed reality. That's, I think, my journey very quickly.
Thank you so much, Pankaj. It is always great doing the story that you share, and I'm sure others might also be loving it. So we move to the next segment. Again, we'll start with Rajiv ji. You have been at the core of the healthcare industry, and you have been part of it for years. So, how will you define the growth of this industry in the last few years? And if there are any experiences that you would like to share with us, then we'd love to know hear it right from you.
Yeah, thank you everyone. And it was really knowing about Sujit Katiyar sir and Pankaj sir. Such a lovely, humble background, and you all are so much giving new insight and new thing to the healthcare industry. Hats off to you. So coming to thing like as an AI model, I don't have personal experiences with the AI and the engineering thing and the technology. But yeah, but I can certainly provide insights into the growth and key highlights of the healthcare industry over the years and how it will the impact of the
XR, what we call this augmented reality or extended reality or mixed reality. So how it can be applied in various ways in the healthcare industry, because healthcare industry as such has seen a very drastic shift after this COVID era. We can say it a COVID era, because we will hopefully not get to see, and we pray that to God that we should not see such a bad calamities in our life again. So, like, there are a few points I have pointed down, like the technological advancement, which is one. So, healthcare industry is seeing a significant growth in terms of technology adoption. Sujit sir is there. I keep following him like anything, and every day I got to see more than two to three messages regarding how healthcare is embarrassing technology and what we can do, technology can do for the healthcare, which will benefit will provide benefit to everyone. So coming to technological advancement, so I'll start with the electronic healthcare records, EHR. So EHR is one of the most critical thing when we talk about starting point in the healthcare technology, starting point in the healthcare industry. After that, we have telemedicine, which the entire world have seen the usefulness of telemedicine, because we at AIMS were the first who created a portal along with the help of Government of India to start telemedicine. And you will astonished to know that we used to deal more than 10,000 cases, and many of our doctors, even though they were working they were doing their regular duties in the wards and ICUs and wherever they were posted, they enrolled themselves to provide the telemedicine, to take the telemedicine calls which were coming from entire country, and we used to address their issues. So telemedicine is having a great future. So we have to look into it, how we can make it more affordable, how we can make it more accessible, how we can make it more patient friendly. And the most important thing is that to reach to the last mile in our country, because still we are witnessing a lot of advancement in technological things and in the technology, but these things are visible and evident only in the rural areas and tier 1 cities. These things are still one of the privilege, or what you can say, one of the most desired thing. And when it will come to the rural areas or the areas which are far ahead from the mainstream land of India, we can talk about like the places in Jammu and Kashmir and Ladakh. I had an opportunity to visit one of the most scattered and far away places in Ladakh, in the Janskar Valley, which is known as Padum. And when we went there, I remember 2021, we went there, and you will astonished to know that the first doctor from outside Ladakh came to that place in this more than 75 years. So our team was the first team from outside Ladakh to visit that place. So we were there for around 7 to 8 days, and thankful to the Ladakh government and the Honorable Member of Parliament, Mr. Chamyang Sering Namgyal. So he made such announcements and advertisements so that people from far-flung areas, different areas of that Janskar Valley, came for our camp, which we conducted for more than 8 to 10 days. And you will see where we used to see people at our places where we were staying. So this was one of the things what we need to when we are talking about advancement in technology. So we should not forget those people. Coming about the precision medicine. So the field of genomics, and now there is an advent of personalized medicine. As we are talking about this technology, integration of this technology into healthcare, we should not forget that now everybody is very vigilant about their personal health. So we'll have to focus about
it tailors the treatment of an individual to up to the genetic makeup, and it can really revolutionize the how we think medicine today. The management will be very different, the diagnostics will be very different, and the drug development will be very different. So it has an immense potential. As we were discussing that how we will, after COVID, how the telehealth has saved its way. So COVID accelerated the adoption of telehealth with telemedicine services, making remote consultations and monitoring very, very easy. But still, though there are a lot of companies in the market and a lot of, old healthcare houses like Apollo has started some work in some of the South Indian states. They are providing some this telemedicine ATMs, health ATMs, through which you can just go to the centers and your BP monitoring or your means pulse monitoring will be done remotely. So these are few of the things which we need to include in our this all kitty, and we should provide the healthcare services to the most far-flung areas. Coming to the artificial intelligence, that is AI and ML, how we will integrate into the current, treatment plan. AI is being used for image analysis, drug discovery, predictive analytics, even in robotic surgeries. So it enhances the diagnosis and treatment options. So nowadays, you might have heard that most of the surgeries done by some very famous surgeons are being done robotically. So with the advent of this AI ML, this robotic surgery has been made possible. Patient-centered care should be made more approachable, and it has a lot of immense potential for giving one of the most good care to the patient. Because nowadays there are a lot of quackery going on, a lot of people who are not associated with healthcare, they have breached into the healthcare fraternity after COVID, because during COVID there was a dearth, scarcity of the trained healthcare professionals. So patient care centric approach we should follow. This will involve in their care decision, healthcare providers focusing on improved overall patient experience. And we need to point out the correct person whom we are going to get the treatment. Because after COVID, such number of people who are quacks, don't have a proper medical knowledge, they have come into practice and they are creating a lot of havoc, not only for this healthcare industry, but for the patients at large. Global health has witnessed a tremendous change after the COVID, and the industry has made a great stride addressing global health issues with initiatives to combat infectious diseases, which is one of them is COVID. Improved maternal and child health care we have to address, because maternal and child health care was badly hampered during COVID. Immunization programs were started. We could not take up the immunization programs. Chronic health disease issues were very rampant during COVID, because those who were undergoing cancer treatments and radiotherapy and chemotherapies, we had to shut down those services because we have to give the COVID services to the people. So TB, chronic diseases, one of TB patients were services were badly hampered during COVID. Coming to the most important thing, what we need to highlight is the data security and privacy, which Sujit sir has said many a times. Because when we are embracing the technology, it's a two-edged sword. Though it will give you something good, then there is something dangerous also. So data security and privacy will be one of the most important things what we will need to address, because digitization of the health records can create a lot of havoc if we will not put much emphasis on the data security and privacy. Because recently, last year, you might have heard that there was a cyber attack, a ransomware attack on the entire system of AIMS. And not only AIMS, we witnessed in some of the most well-known private hospitals like Fortis or Mac, I'm not sure with the name. Safdarjung Hospital also witnessed this thing. So you see how much havoc it can create. And it took more than months to get rid of and to, come out of that tragedy. I can call it a tragedy because I don't know how many patient data from years we might have lost. And we had faced such a great problem during that time that we had to manually write all the reports. We manually had to enter everything manually. And during those tasks, the ultimate sufferer was the patient. So they had to run here and there. They had to wait for a simple thing for long hours. So data security is one of the most important things. As we witnessed that during COVID, most of the European countries and the well-established countries, their population is towards aging, and most of the population is aged. But India has upper hand on that. India has a young generation population. So India's future is bright as we have a booming young population, and we have a focused mindset nowadays with such a progressive thinking government at the helm, because our honorable Prime Minister is one of the most, thinker of a technology thing, because he is bringing, and he is himself a vocalist of embarrassing AI and a lot of newer technologies wherever we can implement. So this one of the young population thing will also give an upper edge to the Indian community. As we say that the challenges and balances in healthcare is increasing, because if we will bring out technology, another challenge will be whether we will increase the cost, will that burden will go to the patient. So we'll have to decide a very nicely that the quality should not get hampered, and the cost of providing the quality should not also increase, because still we are an agrarian society, and most of the Indian society is not very much well to do, and when it comes to health we are much more negligent than any other society. So these are the highlighted points which we need to think when we are putting ourselves on the global healthcare infrastructure.
That was great information from your end. Mm. I would now like Sujit ji to add to this. So you have been working in the health as well as the tech industry, so you have expertise in both these domains. So largely, how is the industry adopting these technologies, be it any tech or AR, VR to be specific? So like you mentioned that even the government is ready and government has taken plans to adopt several technologies. So we would love to know your opinion and your insights on this.
Sure, sure. First, I'll start with certain points which Dr. Rajiv he raised related with the data privacy, data security, and related with the quirks multiple times here. So here, even government is well aware about these things, and these are not just during the pandemic. Uh, it's been happening since long. I think one report up 2019 around some one saving government organization and some NGO or they conducted. So in tier 3 locations in India, usually there are 3 doctors. Okay, so they conducted I think some more than 1500 1800 places. So 3 doctors at tier 3 locations. Out of 3, 2 were not having proper degree. Okay. So either they were from the healthcare, somebody retired as a nurse, NM, and whatnot. They were, of course, you have to have some knowledge related to that, but they were not having some valid degree related to that one. So that is the situation there. Okay. So uh, and surprisingly, okay, we are not having any centralized database here in India. Okay, during pandemic, even the database of the hospitals with the beds, with the specialty, was not at a centralized place. Okay, it's distributed because healthcare is a state subject. Okay, and all the regulations, funding, and everything that comes from the center side. Okay, so the and here also in health at a state level, if you go, so uh, when you start the any new hospital, so there are multiple regulations are there, some 30, 40. Okay, if you go full-fledged hospital with everything, there are more than 100 regulations are there. Okay, but they're they are very distributed, like, okay, so right from the Clinical Establishment Act and whatnot, so many things, but again data not available online, something. So that's how government they started with the this NHA thing. Under that they are having 2 things. One is PMJY, where they provide some 5 lakhs to the family, okay, around 40% population in India. And second was the NDHM, now it's ABDM. Okay, So here what they are doing, they are in process of creating the registries, various registries. Okay, so registries of the population with the ABHA ID. Okay, so they have reached, I think, 35 crores or something. So not what one should expect, but still growth is good. The kind of adoption we have seen previously here, and they are having some DG ID. Okay, and some facility registry. Okay, health professional registry. And the definition of health facility and health professionals, it is very wide. Okay, health professional, anybody like patient facing, and health facility, even the digital healthcare companies, they also come under this one, the health facility registry. Okay, so what will happen, the main challenge was because they are sponsoring around 40% population. So how to track it? And even private players are also involved. Okay, so one can go to the private hospital, get there admitted if they are on the panel of maybe this one PMJY. So you will be getting free treatment there and cashless completely. So that's how government is in process, because then after what will happen, you can verify, because they before allotting, issuing any this DG ID, the healthcare professional ID, they'll verify everything. Okay, so that's how everything will be related to even the health facilities, health professionals, won't be a challenge. Okay, and this is just a start. Okay, they are talking about the data interoperability also, because that's another very huge challenge here. Not only it's adding the cost, okay, because you need to carry the file whenever you are visiting the next hospital or next health facility. Okay, and at the same time, like whenever you visit the doctor, so every time you need to provide this thing, like, okay, all the pathology report, either doctor will prescribe again or something. So uh, so this everything will be controlled. Okay, and again this data interoperability will help in a big way. I don't know how much time we have, but still this is going to be federated architecture from the technology point of view. So it's not like government is storing the data on your behalf. Okay, wherever data is, like you are storing as a health facility, you'll be storing there only. In very crude language, if I say, the address of your information will be stored centrally. Okay, and that's some consent manager and some architecture they have devised. Look, with your approval, with approval of the patient, health facility or a doctor or anybody can access. So the ideal situation is like it's a complete paperless. When I walk into any hospital, I can give my ABHA ID or my any unique identifier, and then my data will be accessed. The prescription of medicine or pathology will be, then I can go to the pathology or this thing, and there no need to carry the prescription, only the ABHA ID, again consent, you can fetch the data. The data, should this pathology report be shared with the doctor, your consent, it will be shared, then prescription. So everything will be paperless. Okay, so that's how government is planning. I'll say excellent move. Adoption is a bit challenge, because as per our constitution, they nobody can be forced to go for the ABHA ID. No doctor even can be forced to go for DG health ID. Okay, so that's the challenge. But what one is getting in return, okay, the incentive, those are many. Okay, even government, they came up with the financial incentives also. Okay, and this incentive is not actually targeted to the hospitals. It is targeted to the in my opinion, it's for the technology companies. Okay, like today when we approach to the hospital and we say, okay, this software will do these many features are there. If the lighter version you start, you need to pay 10,000 rupees per month, and that's the challenge. That's the challenge, because our 70% around is like mid-size hospitals, and they are always having the financial challenges there. So that's how it's again very difficult for those hospitals to go for the technology, full-fledged technology. Okay, they might be having some appointment scheduling things, some financial thing, but they're not having full-fledged HIMS. Okay, if you are like some 10 rupees, 5 rupees for Abha ID for creating, yeah, EHR. So that's how at the end of the month, if you are having some sizable business, some 50, 100 consultation per day, so I don't think you need to pay 10, 20,000 rupees, and over and above you might get some money also. Okay, so that is like, you can see how positive or how aggressive government is. Like, they are paying to use the technology. In otherwise, if you are using any government this thing, infrastructure, or any technology, then you have, ideally you should be paying. If you are using any SDK or any APIs, you have to pay. Here government is paying you. Okay, why? One thing is PMJY, they want to track it. Secondly, government is very optimistic about inbound medical tourism. Okay, so once you are, if you are thinking about inbound medical tourism, of course you should match with the international norms. Okay, so in that case, of course, it might not be exactly matching, but it should be to a level. Okay, and same goes with the data privacy thing. Okay, because again, being like if we go by the volume of data consumed here in India, okay, we are at number one when it comes to the data consumed on the mobile device. Okay, and we are at number one in combined second and third. We are way above that. Okay, so when you are having such type of digital infrastructure, then of course privacy and other things are mandatory. As Dr. Rajiv was mentioning, this AIMS and other attacks. Why these are attacks? Because we are creating the maximum data, even in healthcare also. The maximum data is created by India right now, even in healthcare. Okay, I'll repeat again, because it's not only the private players. Okay, coming to the government, certain initiatives like e-Sanjeevani, it's like globally adopted in many countries. I don't know exact number, but it's been like they are talking to multiple countries to adopt this, because this is full-fledged thing. Not only this telemedicine thing, it's having the OPD registration and everything. This is fantastic software, and they are having many things over there. So this is it. Okay, so if you have other things, because I think we are like closing to 6 p.m. So I don't know how much time we have. Otherwise, I have so many things to share.
So
So
definitely, sir. So just a follow-up question to this. So we have talked about all the technologies. I would just like your opinion on how XR can be adopted in the healthcare. We have seen
yeah,
multiple.
definitely. As far as XR is concerned, I am keeping very close eye on this thing, because the way I was expecting, adoption is not that good. In spite of having such a wonderful offerings are there. Okay, so I think some 3 years back, I got opportunity to interact with one company named 8 Chili. Okay, so whatever I understood from there, it was excellent. Rather than trying experimenting on the somebody live. Okay, so we can create the simulation kind of thing, and better training can be provided. Okay, from the if we talk about the care giver side. Okay, so they can be trained. Okay, from the academic point of view, a lot of better training can be provided, and from the patient side, because I was part with some NHS projects also. So that was again surprising. It was way back, I think some 4 5 years 6 years back. So it was like something related to the pain management. And I say, how pain management and the technology there? And the initial it, and later on they were developing something, okay, to distract and this and that. So these kind of things can help. Okay, there is possibility of many other use cases there. Okay, so because slowly gradually in all areas it is there. Okay, but not to the level it should be. Maybe there might be some financial constraint, because India is a very price sensitive market. Okay, so that can be the thing. Regulatory, maybe that's not a till now it was not a big challenge, but now it is going to be. uh, there might be other adoption challenges there, but I'm very hopeful, I'm very excited from that, what technology is offering. Okay, so when certain things are in place, then of course it might take time, but it is bound to happen. So that's what I have about XR in short. Yeah.
Definitely, definitely a lot to talk about that. Since you mentioned the point wherein use cases, and so I would like to ask Pankaj to share his views. What are the possible use cases of XR in the healthcare?
Okay, thank you, Krishna. So amazing to get so much deep insights from Rajiv ji and Sujit ji within the healthcare space. And this is not something that we easily get on public forums as well. Anywhere you go on social media, you might not get deep insights like this. Thank you so much, both of you, for sharing this key info. Coming back to you, Krishna, I think there are multiple use cases. In my mind, I break it because you've been within the XR industry. We see a lot of use cases that are coming either at POC or at large scale implementation level. In my mind, I break it in three parts. One is pre-surgery, so that is wherein either on simulation or training use case, then during the operation or surgery, and then post-surgery aspect as well. Pre-surgery, I think one big use case which I saw was very impactful is pre-planning surgeries, which are very complex. So recently, I was reading up somewhere wherein a mother has given birth to twins, which their heads were joined, right? And the planning that surgery is usually one of the most complex surgeries, and you have to pre-plan. So they did a lot of CT, MRIs, converted into 3D models. Within the VR world, they practice how do they do the entire surgery. So pre-planning and trying to do that training is one use case which I think is very helpful. Recently, I was also talking to a company who is working with us, wherein they're helping doctors like pre-plan a lot of these complex surgeries by taking their CT MRI data, converting it in 3D models, and helping them. Second is training of staff, whether it be nurses or non-surgical staff, uh, whether it be paramedics or all of them, for multiple activities. Recently, I was speaking to one of our team members who is within the government space, within the healthcare. He said there is a huge deficit of people who know good understanding about dialysis machine and ICU machines, who have a strong understanding of how to use them, and which is one of the biggest leading reasons, which is leading to a lot of this wrong handling of this equipment. So it causes a lot of deaths, right? This is what I have understood. So training this could be something which is very critical and helpful. Then during surgeries, one is getting critical information in front of you, either overlaying onto the patient's body, whether it be CT, MRI data, or 3D cross section, which will help during the surgeries. And post surgery, whether it be recovery, wherein someone who is bedridden, you give them an experience, you help them convert a negative mindset to a positive mindset. Recently, there is a startup that has come in wherein for parents who can't really travel after surgery but want to see the world or want to visit various temples, they are creating this specific VR experiences for them. That is wherein I think there is a lot of implementation. One thing I would like to touch upon is the implementation. Some cases early POCs are happening. Both the reasons which Sujit ji mentioned are critical. One is financial, in terms of the costs that are involved for deploying like this are slightly higher currently. That becomes a challenge. Second is the regulative bit, and specifically within the surgery aspect, right? So that is when not even patients and doctors are willing to take that early risk, wherein a very strong regulation comes in and understanding. So pre-surgery, that is wherein simulation and training, there's huge potential, and post-surgery, that is wherein we spoke about some of this. Sitting at home, we could travel the world or help build a mindset. It could be one of the example wherein helping individuals get rid of their fears. Let's say someone has a fear of a spider. Instead of bringing a real spider, you bring a VR based spider who's slowly coming closer, and basis his reaction, you slowly keep that engagement coming and decreasing. recovery in terms of someone who had an accident cannot walk, but helping them build that muscle memory of moving his leg. Initially, just in the mental model using a VR headset, and he's doing something. So things like this could be one not regulatorily heavy, but financially or also not heavy, because the end user, either the customer, is willing, because the cost of getting back and walking is cheaper. The cost of this device is cheaper than that, right? So I think that is where the implementation will happen.
That was well portrayed, and definitely mental health is one of the major areas. People suffering from PTSDs or others are also, they find a great use case with VR. And training is definitely, we have seen multiple institutions as well, health medical institutions, wherein they use now VR devices to teach doctors or for practitioners so that they can work in VR and not just in an actual human body or human anatomy. So that's wonderful. So before we close, I have one final question for all of you. Where do you see the healthcare industry grow in the next 5 years?
So I think at the start only I mentioned this decade is going to be digital healthcare. Okay, and related to in India, all the different pieces. Okay, they are coming slowly, gradually in place. Maybe I can touch upon, because everybody was talking about the regulation part. Okay, so regulation in healthcare, that's itself a very huge topic, but still it started way back. Okay, so the healthcare data is treated as sensitive personal data. Okay, because one normal personal information, one sensitive personal information. So that's how it started way back in 2000 with the IT Act, and then in 2013 we have another addition to this act. And then after, I don't know how many people they are aware, when it comes to telemedicine means where doctor and patient, they are distance apart. Okay, so in that case, uh, in we were not having any kind of regulation or law related to that one. So in absence of any regulation, the judgment pronounced by higher court, they become law. Okay, so that's anywhere, including India. So one judgment, I think in 2016 or around, from this Maharashtra, this Mumbai High Court, that's very clearly mentioned. That was very specific. I don't go in detail, but it was related to, like, until unless doctor is not physically examining the patient, that patient cannot be diagnosed. And when you cannot diagnose, you cannot prescribe. It was as simple as that. So it was like it was a closed door for telemedicine here in India. A good thing, because of pandemic, I think at the start itself, in this 2020, government of India, they came with the telemedicine practice guidelines, and everything was like black and white. Okay, there was no gray area. It was complete black and white. Again, here to another challenge was, to practice in any particular state, you need to register with the local body, state medical council. So you can practice in that particular state only. But when it comes to telemedicine, how you are limited? You are across India. Okay, so what? So that's how this law is like everything clear. What is the responsibility, the KYC thing, and everything was there. Okay, majority thing were on the technology platform. Okay, so that will be used. So that's how that was the thing. And then the need was related to the privacy data. Okay, so privacy again, fundamental right. Okay, there is a history attached to that one. So now, last month itself, in the month of August, uh, we are having a privacy law. Okay, so DPDP, Digital Personal Data Protection Bill. It is like unique in many aspects. Okay, and the best thing is to take it seriously, is the penalties. Okay, the penalties are huge. Okay, not only in the history of India, in the global history also, this is huge. This is in the range of 250 CR Indian rupees. Okay, and that's not the overall. This is per data breach. Okay, it means if you are having 1,000 customers, and the data is compromised of all the 1,000. Okay, and you have not taken the reasonable care while data protection, and you have not informed also. Okay, so that's again, there are certain lines, like you need to inform to the government also. Okay, and you need to inform to the individual whose data has been compromised. You have not done anything. Then 250 CR and multiplied by your customers. That can be the penalty. That can be subject to so many stars there. Okay, so because this only act is there, rules are, we are waiting for the rules. Okay, but I will suggest this is a serious matter right now, not only from the penalty point of view, from the, if you respect the data privacy, from that point of view, it's again equally serious. Okay, so slowly, gradually, all the technology companies, not only in healthcare, otherwise also, should start working in that direction, because what I see, in another 3 to 6 months, things will be serious. How long it will take to the implementation, only government can tell. But I don't think they are going to provide us some 2 years window like GDPR. That's highly unexpected. Like, okay, that's not possible at all. So they can provide some 6 months or so. Okay, so this is and believe me, you need to make huge changes, not from the tech point of view, from the you download any app. Okay, the first thing, your mobile number, email ID. So the reason why you are taking the data, the journey starts from there. Before asking data, you should be telling the reason clearly, very clearly, with the duration, with for what purpose, the purpose limitation, duration limitation, everything is there. Okay, if you are taking this data for like just I'm visiting any exhibition, that your duration is 15 days, 1 month. Beyond that, you have to erase the data. Okay, so there is list of options are there, but I have been requesting to everybody, take it seriously. Otherwise, it can create a lot of problem. Even if you are penalized twice, okay, so third time, government can decide to blacklist your platform. Okay, so that's government. It's not like government, they want to make money out of it. It shows the seriousness. It shows the seriousness, how serious they are, that industry should adopt it. So that's from my side. Okay, so I'm open to any question if you have.
We'll move to Rajiv ji. Sir, your views on how will the industry adopt technology in the next 5 years?
Hi. So the future of healthcare industry is very promising, and the adoption of extended reality, that is XR, is expected to play a significant role in shaping the healthcare over the next few decades, you can say. Here is there how I foresee the adoption of XR in healthcare industry. So talking the first point, it provides us enhanced medical training and education. So XR has a very good future. XR will continue to be a cornerstone of medical training. As Sujit sir said, Pankaj also mentioned that medical training, it will offer immersive simulations, and for students and professionals like surgeons, we are already using most of the simulation devices, and most of the simulation practices are going on in our healthcare. So this XR adoption will give us a broad spectrum of enhanced medical training and education to our upcoming students and upcoming persons who are trying to join healthcare facility. Most will be those who will be benefited through it will be the surgeons, because we have this already in practice, robotic surgeries and all. So surgeons will use this XR technology for honing their skills of different types of surgery, sitting at one place and operating at the another place. That will be really beneficial to both doctors and patients. It will be more safer also. Okay, and it will be more efficient, because there you will have the privilege of asking one of the most renowned doctors and specialized doctors to intervene in when certain conditions will arise where means the skilled doctors only can perform that surgery. as Pankaj mentioned that he had faced some, and he got some news about some conjoined twins. And you might be hearing a lot of stories and a lot of news from New Delhi AIMS that New Delhi AIMS team has separated a conjoined twins or operated on a very critical case like that. So there, the use of XR technology is very imperative. Then we come to improve diagnostics. That is my field actually, diagnostics and treatment planning. So XR will provide in-depth and knowledge into the diagnostics, because diagnostics, as I said, it has moved towards personalized medicine, genomics, proteomics, and a lot of things. So XR will definitely provide in-depth knowledge. It will also have interactive 3D visualizations for the patient data, which will enable us more precise diagnostics and treatment planning. So this XR will be very, very boon to our patients and the medical fraternity in large. Radiologists, surgeons will make use of XR for better insight into complex cases, because a radiologist has to give us an insight before any treatment, nowadays cancer and whatever surgeries we are doing. So radiologists views are very important, deciding the different path of a patient's journey. And we all were discussing about telemedicine. So telemedicine has not yet evolved properly. So with the advent of this XR technology, telemedicine will also see its days. Like it will go to the places where it has not yet reached. Telemedicine will become more immersive through XR. It will allow doctors to remotely examine patients. Like we will feel like that we are sitting in the same room where the patient is and we are examining. So XR will definitely have an upper edge when we will integrate for the telemedicine services. It will be more advanced virtual home-like situation, mostly for the cancer patients, for the chronic disease patients. So telemedicine will be definitely having a say in the XR technology. Coming to this advanced surgical assistance. Surgeons will be using it and relying it more on XR surgical navigations. Robot guided surgeries will be easy to perform, and patient engagement and education will be also one of the most evident thing, because XR will provide a standard tool for patient education, for educating the new lots of people who are coming to the healthcare industry. It will allow individuals for a better understanding of the conditions and situations and treatment options. So patient will use this AR and VR apps. As Krishna ma'am also said that mental health cases are being also addressed with the help of this AR and VR applications, like PTSD. PTSD is one of the most well-known disease in the mental disease when we talk about. Then anxiety issues, PTSD issues. This AR and VR can address it very nicely. We'll also have an option of remote collaborations. XR will facilitate remote collaborations among healthcare professionals. It will allow us to consult cases, surgeries from different locations, not only in India, but abroad, in US, Europe, wherever we want to consult doctors. They will improve the access of the specialized care and the cases which are not well known into different areas. Drug delivery and testing is one of the most important thing that XR will be going to address. XR will be used to simulate the effects of new drugs and treatments. It will improve and accelerate the drug development thing. Clinical trials, we can say, when we will incorporate XR into our clinical trials, it will enhance the data visualization, because for trials we are using we are taking patients randomly, selecting a lot of patients, and there was a lot of hue and cry earlier. There is a lot of legislations on this patient clinical trials for the patient. So if we use this XR technology, I think that areas will be also addressed very nicely. And the most important thing which Sujit sir has discussed in very length and breadth about the data security and privacy. So this XR will become more integrated into healthcare. Issues of there will be heightened issues of the data security and privacy will be there. So definitely government is working on it, and we need a robust regulation and cybersecurity measures in place to address those issues. So as I said that technology is a double-edged sword. It brings one side, it brings us a good thing, and second, there's a danger also. So it will also impact the global health thing. Like India is one of the most booming country in global health, so it will set a standard of the Indian healthcare industry in front of the other countries, that we are also accepting the future technologies in the form of extended reality to understand the different things of healthcare and to provide better healthcare services to our people. Ongoing innovations, one of the most critical things is the ongoing innovations like in XR hardware, as Ajna is doing this, and software driver, and this adoption will definitely will create a different story for the patients. But the most important thing, that time and again we should think that we have to make this XR solution accessible and affordable. Affordability and accessibility should be the utmost thing what we need to put a stress on from the private players as well as the government also. Because look, technology, when new technology comes, if we will not address these issues, it will be limited to the few people who can afford it, but that will not serve our purpose. We, the only purpose will be served when we will make it available to the most poorest of the people in our country. So this is from my side. Thank you very much.
That was quite a great information from your end. To finally close this, I would like Pankaj to add his 2 cents on the topic.
I think both of them have really done an amazing job in terms of sharing this information. One place I think where I see I can add value is one thing that Sujitji and both of them mentioned is the privacy, data security, which is a big concern, and India is taking such an amazing step in making sure that data privacy is a key thought in everyone's mind. If you have penalties like this, everyone will make sure that this is something which is critical, which I think should help drive two things. One, make in India softwares, where the software is here, the servers are also here, so which helps us to have more control over the data. Not just that, but the hardware as well. As medical organizations or even enterprises and even individuals, we should start preferring Indian devices over international devices, because that helps us control this data even further. I think one of the biggest challenges within the US is they banned quite a lot of other Chinese brands because they found out that they were leaking a lot of information outside the country. In same way, as India, we should also start doing things where we prefer Indian brands because we can keep data and protect our privacy here. On that note, I think we can close.
Great. It was great having all three of you on the panel today. We had learned a lot about the healthcare industry and the nitty gritties of it. Thank you so much, everyone, for coming to this session. We look forward to having you another time in another great session. Namaskaram.
Thank you.
Namaskaram. Thank you so much.